numerous convicted fraudsters, numerous convicted violent felons, suspicious billing patterns where companies emerged from nowhere billing hundreds of thousands of dollars in the first month of business and existence. Obviously this raised red flags, and then we looked into what fraud prevention measures Ohio has. The answer was essentially none.
Hey, welcome back to The Narrative. Aaron Baird, David Mahan, Mike Andrews is on leave today. Is it vacation if you're suspended? I don't know what the rules are. No, it's just a suspension for just general. I don't know. We can't. HR prohibits us from talking about these things, but we think he'll be back at some point. It's kind of like when Bill Simmons got suspended from ESPN. You wouldn't know those things. You don't watch sports.
Richard Simmons, the guy.
Bill Simmons. Come on, man. This is why Mike's suspension won't be permanent, just because I need somebody that actually watches sports. Exactly. But no, just kidding. Mike's on PT. He's getting a break from the craziness around CCV for the week and looking forward to.
Does Mike actually play sports? Has he ever been an athlete?
I don't know. See, that's a lesbian. Come on, man. I mean, that's a dangerous
thespian.
A thespian. He is. That's a dangerous question, because Mike looks like one of those guys, and I'm sure you've been cooked by these boys plenty of time, where you look at him, you're like, oh, that guy, he shows up on the pickup court, and you're like, oh, they've got nothing.
Yeah, with and the then tape in the eye glasses.
Exactly, and then he stands in the corner and just, exactly, roasts you the entire game. Maybe he does, or maybe he is just
or he's just lame.
Exactly. 50-50. You could be either. I could see either one of those things.
I'm not picking anybody.
Exactly. I will. This is complete. And this is why we need Mike here, because we get completely off here. But when I fun OU story. When I was in college, I worked at a bar and grill called Skipper's, and there was it was a townie bar, right? So we had a bunch of hippies that worked there, and there was a guy named Woolsey was his nickname. He was a Grateful Dead head. He had literally hair down to his back. Was everything that you would think a Grateful Dead fan would be. And we started. There was a bunch of college guys there, and we started they had interleague basketball. And Woolsey was still technically a student at OU, so he could play on the team. And he was like, "Oh, I want to play with you." And we're like, "Woolsey, there's no way you could play." Well, it turned out this guy who was like we were all like 19 or 20. He was 24 or 25 at the time, which means he was super old to us. And it turned out he held the Division IV record for 3-point shots at Norwalk High School when he was there. And he just came out there in his hoodie and all that and just drained threes the entire. And we were like, oh,
those guys exist.
They do.
They're everywhere.
You can't read them, right? Anyway, that's not David. We got to get focused here. We've got a really good interview today, but first, just one bit of news that ties into everything that we're dealing with right on the life front right now. There's just been so many developments over the last few weeks. For those of you who are on the CCV email list, you see we've been really doing a big push around the abortion pill again, trying to get folks to contact their congressman, to tell the Trump administration to reinstall at least one in-person visit on the abortion pill on mifepristone. That's the abortion crime by mail campaign that Peter Range is leading for us. And there was some good news and bad news this week that I think for a lot of us in the pro-life community, I think we're actually seeing some progress on getting the Trump administration to do the right thing on the abortion pill. The bad news was the Louisiana case, and you saw this one where the Fifth Circuit had originally ruled in our favor. The Fifth Federal Circuit Court ruled in our favor to say that the abortion pill could no longer just be mailed into states. Yeah. This was a lawsuit brought by the Louisiana Attorney General, and of course the abortion pill companies filed an emergency appeal up to the Supreme Court. And unfortunately, in a 7-2 ruling, the court blocked the Fifth Circuit case from going into effect, from staying into effect, their decision from staying in effect, which basically the Fifth Circuit said you can no longer mail these pills all over the country. The Supreme Court said, nope, we think there's a high likelihood these abortion drug companies, their lawsuit is going to succeed, is going to defeat the Attorney General's enforcement on this. And therefore, these abortion pills are still allowed to be mailed while the Fifth Circuit does a longer hearing on the merits of the case is what it's talked about. So unfortunately, and Dave, I mean, again, your wife used to work in the pregnancy care center movement. This means these abortion pills can still get sent all over the country and has a devastating effect.
Right. And I mean, I'm not losing hope, though. I mean, sending it back down to the lower courts, eventually it's going to make it back up.
Right.
Right. And I think there's some encouragement in, the dissents of Thomas and Alito. And Thomas basically was like, no, you can't claim irreparable harm because you are a criminal, what do you call it? A criminal enterprise.
Right.
Because of the Comstock Act, you shouldn't be allowed to ship this stuff via postal service anyway. So you can't claim irreparable harm. And I think, eventually I'd love to hear more of that argument when it gets back up there. But, we don't like to see a loss. But again, it's just one battle of a much larger war.
Yeah, and I think that Comstock point is a great one. That it really is inexcusable. There is no way under law that medication like this, deadly pills like this, should be allowed to be shipped across state lines. The Comstock Act is very clear that this is illegal, and
for the purpose of abortion.
Yep.
Right, and that's what it was about.
And this is what's frustrating about this is, and this is what folks need to understand. It's not just about passing, about electing good folks or passing good laws. It's also about enforcement. And if your U.S. attorneys don't go about enforcing the law, enforcing Comstock, it has no authority. Now, so that's the bad news of the week, was that we didn't get the Louisiana case upheld. The good news of the week, though, that shows some political, I'd even say political power from the pro-life community, was FDA Director Marty Makary last week resigned. Now, for those of us, I got to tell you, for those of us in the pro-life community that have been working on the mifepristone issue basically since President Trump came in, there's perhaps no greater disappointment in one of President Trump's appointments than Marty Makary. Marty Makary came in with some there were some red flags in his background on the abortion issue that gave some people pause. A lot of us wanted to give him the benefit of the doubt because the president has been very strong on the life issue in many ways. This was an appointment we said, I'm not sure about this guy, but let's see what he can do. Well, it felt like the worst case scenario because when the Ethics and Public Policy Center and the Restoration of America reports came out detailing that the harm from the abortion pill is 20 times greater than what's on the label.
Be safer than Tylenol,
exactly.
0.5%.
And HHS, so Marty Makary's boss, Robert Kennedy, committed to the Senate that they were going to be reevaluating the FDA label. And from all we could tell, and again, it's all this is from the outside, but from all we could tell, Makary had done nothing to actually get to the bottom of the harms of the abortion pill. And actually, he went about approving a generic version of it in the meantime.
This should have taken weeks.
Yeah, it was nonsense. And so there was increasing pressure. I wanted to see Makary gone. I called for him to resign. Not that was the reason, but there was a lot of pro-life leaders that stepped in this. Marjorie Dannenfelser from SBA, Pro-Life America. Lots of folks were calling for him to resign. There were a lot of other folks in sort of the MAHA, Make America Healthy Again movement that were getting frustrated with Makary. And it seemed like bubbling up in the White House, there was folks upset with him. And the fact that he was basically forced to resign is an encouraging sign.
I'd say so.
Yeah, that we could actually see at least the in-person visit reinstated, and then hopefully get the FDA label to be completely reevaluated. The new acting director, there's some question marks about him too, but it seems like he's going to be more open to the pro-life message, for the pro-life concerns, not even the message, but our concerns. We're not asking these guys to do anything outside their authority or to do us any favors. We're just asking them to enforce the law. So that's encouraging news. And then even more on the Ohio front, David, we had a pro-life bill make some progress this week, right? You just testified on this.
Yeah, HB 324, that's the Patient Protection Act, sponsored by Matthews and Craig. just recently. Many of you heard of us talking about this past the House. And
ever heard of me? Sorry. I know that's what you were saying.
I take back what I said about Mike. We need you. All right, please come back. But no, we had a hearing actually today, proponent hearing on that bill. I testified in support of the bill, and basically what it does is it's still dealing with mifepristone, basically saying that any drug, not just mifepristone, but any drug that elevates to the point where it's got more than 5% severe adverse effects. So we're talking about like hemorrhaging. We're talking about hospitalization of some sort, death. If it's got more than 5% severe adverse effects, then we need to have a couple in-person visits. We need to have some informed consent, and we don't need to have it being shipped via the U.S. Postal Service, where folks aren't going to be getting the treatment and the care that they need. And the questions are ridiculous over there, but you could tell from the committee, from sponsor testimony as well as proponent, this is going to be a slam dunk, just like it was in the House.
And this is also the other reason we need Mike, because my phone's ringing in the middle of our
apart, family.
Listen,
jeez.
Now, real quick though, David, explain to the listeners, as I'm sure you explained to the committee, why this doesn't violate the abortion amendment. How can we pass another abortion regulation after the abortion amendment passed?
Yeah, because it doesn't just target mifepristone, right? We've got cancer medications that are above 5%. We've got antidepressives, antidepressants that rise to that threshold. So it's not just dealing with mifepristone, but we are seeing that mifepristone has an 11% severe adverse effect. So it would definitely fall under this bill.
Yeah. Yeah, and I just got to ask real quick, favorite crazy question you got out of the committee today? What was your highlight of because you get some pretty crazy questions when you're
why don't we, just stupid questions, right? So why don't we support FDA studies that are already out there, right? Like the initial 31,000, shoot.
Yeah, it was something like they did 31,000 cases. How they originally approved the abortion pill, there was 31,000 alleged individuals who took it, and handpicked. That's exactly the problem with it. And the Ethics and Public Policy Center went through. Hey, all of these studies before had massive holes.
That's right.
That we would never go along with.
It's almost 3 decades old,
right?
But based on that data. Under the Clinton administration, they said you need 3 in-person visits. And on top of that, you have to be in the clinic or the hospital to actually take, to be administered the drug.
Yeah.
All we're saying is 2 in-person visits and some informed consent.
Right.
And we're getting, kickback. And the difference between what EPPC did versus that original 30,000 set is that EPPC, it's not a study. It was
a survey.
Yeah, it was a survey, an analysis of actual insurance claims and codes, of severe adverse effects as related to mifepristone within 48 hours of being administered. So this is very, very detailed information. And really all the bill's saying is that we need to be looking at not just that one study, but we need to be having the health director talk to the insurance director and talk to some of these other folks that are involved in the medical community here in the state of Ohio.
Right. It's not self-selected. It's everybody using private insurance, right? So whether you want into the study or not, all of that data is what's being used for this.
Right.
And how we could actually see what's the real world. That was the thing about the whole EPPC stuff when it first hit was this is the most accurate picture we'll get of this, because it was over 900,000 individual pieces of patient information, or individual patients, I should say, looking at their long-term effects, which is by far the biggest scale and analysis on this pill ever. And not just people who say they want to be a part of it, just everything that's available on it.
Yeah, and in the bill it says so the insurance data, but it says all applicable data.
Yep.
Right. So that would include FDA.
Yeah.
We could look at the 31,000.
Right.
And so that was the stupid question, is that they try to make it seem like we can't look at that kind of data.
I'm so glad you handle all that testifying now. I don't you know, that's
I've seen this man over there. He probably
God
forgot where
bless
the
you.
bathrooms are.
I honestly,
Him and
a
Troy,
little
real
bit,
talk.
yeah. Oh, come on. All right. We got a great interview coming up here in just a moment, and we'll be right back on The Narrative.
If you've got something to say, we want to help you say it. I'm Vince Tornero. Since 2018, Westler Media has helped churches, organizations, and events amplify their message through podcast, video, and social media. We also happen to produce The Narrative too. Let's talk. WestlerMedia.com. WESSLER Media.com.
My name is Lauren Metters, and I'm the Business Development Manager for the Christian Business Partnership. I want to invite you to imagine something with me for just a moment. Imagine if every Christian business owner in Ohio tossed a single rock in the same pond. One person tossing one rock makes a ripple in the pond, but thousands hitting the water at the same moment can make a big wave, big enough to change the entire structure of that pond. This is what happens when we join forces. Suddenly, we aren't just protecting Christian values in the marketplace. We're shaping the future of our communities, our economy, and the next generation. When Christian business owners stand together, we create real impact. That is why the Christian Business Partnership exists. Our members gain access to affordable group rate health insurance, discounted workers' comp, and other programs that protect your bottom line, all while amplifying your voice at the Statehouse and standing strong for pro-family and pro-business legislation. Join our community where hundreds of Christian employers grow stronger together every year. Visit cbpohio.org today and become part of the movement.
And welcome back to The Narrative. Aaron Baer, David Mahan, Mike Andrews is on the lam after his home healthcare company got exposed by the Daily Wire, which is because of our new guest here, Parker Thayer from the Daily Wire. Sorry, Parker. Mike is our third host of the podcast. I probably should warn you before we brought you on that we were going to be taking a shot at Mike.
Well, if Mike's anything like the people we saw in Columbus, he probably fled the country.
Exactly, that's right.
Which one of them actually has, by the way?
No, see, that's I was already teeing us up, right? That's but we've got Parker Thayer here. Parker is an investigative researcher at the Capital Research Center, a native of Michigan. He recently graduated from Hillsdale College, and he was one of the lead researchers on this the Medicaid million story that has just been everywhere all across Ohio, but really everywhere all across the country. That the Daily Wire produced with Luke Rosiak. And Parker, thanks so much for being here with us, man.
Of course, it's great to be here.
So, Parker, just to get us going, can you give us the high level of what your report exposed for folks who might not have seen the Daily Wire reporting? I know there's been a number of stories that unpacked all that you guys found here, but what's the bullet points for folks that are just stepping into this issue here?
Yeah, like you said, it's a huge story, but if I had to pick the bullet points, I'd say, so there's a program in Medicaid. Medicaid, of course, is run by the states. This program in Medicaid is called the Home Health Program or Home Care Program. And what it was supposed to do was save Medicaid a lot of money by allowing people who are on Medicaid who might be in need of, nursing home facilities or care similar to that, to avoid going to the nursing home and pay people to provide, services and health care needs for them at home. That's what the program's supposed to do. The problem is that once you allow people to stay in their own homes and then pay people to go and take care of them, first of all, that introduces a environment where you're counting on the honesty of two people alone in a room together. And the other problem is that often those two people are familially related, which, again, sounds like a great idea. It's much better than a nursing home. The problem is that a lot of people are willing to lie to get paid by the government to stay home. Not as many people are willing to lie to get paid by the government to go into a nursing home or have your nursing home paid for. Suddenly, once the home care program was created, the spending on these nursing needs suddenly skyrocketed in Ohio in particular. This was a huge example in Ohio, particularly the city of Columbus, which is the second largest Somali community in America. We found that there were best example we found was there was one landlord that owned seven buildings on basically one street of Columbus. And in between all these buildings, there were 280 home health care companies registered that were billing somewhere on the order of $250 million over the last few years for these home health services. 38% of all of the state of Ohio's spending on home health was basically in this on one street of Columbus, which was the Somali-dominated area of the city. All of these companies were run by people from Somalia. We went to these office buildings. They were all empty. There were doorknobs missing from doors, mail piling up, empty offices everywhere you look. The few people we did see were openly hostile, accused us of racism for asking very simple questions that had nothing to do with race and everything to do with government spending. It was a surreal experience, and we ended up digging into the background of some of these people. Numerous convicted fraudsters, numerous convicted violent felons, suspicious billing patterns where companies emerged from nowhere billing hundreds of thousands of dollars in the first month of business and existence. Obviously this raised red flags, and then we looked into what fraud prevention measures Ohio has to do these. The answer was essentially none.
Mm-hmm.
That's as short as I can make this story. It was a massive undertaking.
Yeah, I mean, I'm on that story right now that you guys wrote about this. The 7 buildings along East Dublin Granville Road in Columbus, Ohio, are filled with hundreds of office suites, all owned by a company named Cordoba Real Estate. A large majority of the tenants in the buildings bill Medicaid, the taxpayer-funded medical program for the impoverished, as a home healthcare business. In all, the Cordoba-owned buildings in Columbus house 288 businesses registered with Medicaid, and the Daily Wire investigation found together they charge taxpayers more than $250 million, as you said, in a city where there's only 6,200 people 75 and older. So that's a pretty good ROI right there on a per patient basis on Medicaid home health. I got the paragraph I skipped in between there was the Daily Wire spent weeks analyzing Medicaid data released by the Trump administration during DOGE. Can you talk about how you guys pinpointed this? How did you find this in the first place, Parker?
It started with a different story I was working on a federally funded nonprofit called the Eunuch Foundation in Columbus. And what they got a grant to do was the New American Anti-Recidivism Project. So it was basically, there were so many, refugees and immigrants that were landing in jail for various crimes in the Columbus area, that the federal government distributed $800,000 to a nonprofit specifically for the purpose of giving them job training and addiction counseling to get them out of prison and hopefully, be productive members of society. The problem is that this nonprofit was a private foundation. They had no accountants, no lawyers. They had a one-person board of directors. The one person who was on the board of directors is a member of the Somali American Chamber of Commerce. He has a long history of running company after company after company, all of them doing nothing really discernibly public and then kind of dissolving after a few years. The financials were the most suspicious financials I've ever seen. I have a whole article on that. But while I was doing that article, I noticed that in the same office as his company were several home health care companies. So I looked into them. They had some pretty suspicious people involved in their boards. Some of them convicted fraudsters, some of them accountants who had lost their license for scamming the elderly back in 2008, and now we're running home healthcare companies which take care of the elderly. And then I looked next door to that building, and then there were more home healthcare companies, and then I looked next door to that, and there were more, and then I noticed that the entire street had dozens of them. At that point, I realized I was looking at something, much bigger than I had ever worked on before. So I went to Luke Rosiak, who's an amazing reporter at the Daily Wire, and is their guru on large data projects and also government spending. And together, he whipped up some computer programming and some code that I could never have done, and showed me that the problem that I had found was actually way bigger than that. It was hundreds, not dozens of companies, and there were dozens of office buildings, not just those like 4 or 5 that I had spotlighted. Like it was out of a movie. I mean, that's the only thing I can describe it.
That's my point. So when we're talking, we just had A.G. Yost on, and when we're talking in the community about this topic, it's so large. A lot of people just can't seem to believe it. The first question they go to, and you just mentioned this, is what are some of the fraud prevention methods that maybe other states? I mean, Minnesota.
My answer for this question is going to make people mad. And it should make people mad. And A.G. Yost, who you mentioned, he's mad about this as well. He was when we started looking into what the fraud prevention measures were, one of the first things we found was him complaining about how there were basically none. And like that, not only there used to be some, and then they were turned off. And he made this point in front of the state legislature. So the main verification system for in home care specifically is a system called electronic visit verification, or EVV. What this is basically an app that you put on your phone, and when you go and perform the home care at someone's house, obviously it's just you two alone most of the time, maybe them and some other family members. So it's hard to track that sort of thing. So we implemented kind of like a bare minimum skeleton form of verification for this, like this, compared to the things like the VA, which is serving our veterans, and they have very strict controls to make sure that those programs aren't being defrauded, and it's often very hard to get benefits from the VA. On the other hand, from Medicaid, there's this EVV system. EVV, you put an app on your phone, and it basically, it's federally required, by the way, or supposed to be. It checks your GPS location when you do the visit to make sure that you're actually at the house that you claim to be performing the care at. And also, usually it'll require like a digital patient signature at the end of the visit, and it allows you to keep like a timesheet. So every 15 minutes you check in and say, I've done these services, I've done these services, I've been here this long, I'm at this location serving this patient, etc. Pretty basic stuff. Like you would expect this from any private sector job. Like that would be a very reasonable thing to ask. In the state of Ohio, EVV was basically neutered. Starting sometime around 2021, as far as we can tell, the GPS verification became, instead of a requirement, it became a opt-in system. Patients had to sign a form consenting to using GPS. When we asked the Ohio State Medicaid Department, just a couple last week, I think, how many, what percent of patients weren't using GPS, it was about half of patients. There was no GPS verification. The signature requirement was also turned off. So no one really was using the signature requirement. So those two things, but with those two elements removed, there's no verification at all. You're just turning your own timesheet and they pay you. But that's not the really bad part. The really bad part is that we found out that, and this is something that the auditor of Ohio found back in 2024, the EVV system isn't actually used. Not only did they turn off the parts of it that make it actually good, they just stopped using it entirely. Over half of Medicaid payments, and this is according to Ohio's own auditor for the home care program, went out without any EVV records being submitted at all. So not only did they neuter the program, they're just not using it at all. So you can just submit your claim. They'll pay it, even if there is no records submitted to prove that you actually did it at all. The department that collects the EVV data and the department that pays out the home care, the Medicaid, they don't actually talk. They don't communicate. So they've spent $100 million, mind you, on this app to collect this data, and then they just don't use it. It just sits on a shelf somewhere.
Oh my goodness.
That is actually how it works. And after we had researched all of this, all this fraud, we knew, obviously the verification system is not good. It's not working. And we were still shocked when we found out how little it actually was doing.
Right. Well, it wasn't working at all. I mean, even the crazy thing about Parker, as you just described it, even that system in and of itself seems inadequate, right? Just like putting an app on your phone, that's going to be enough.
Yeah, you could just log in. The way the fraud works is that patients will often get kickbacks for signing up for care they don't actually need.
Right.
And the doctors will also get kickbacks for signing the form for those patients, right? So it would be pathetically easy just to log in as your provider from your own phone.
Right.
There's nothing stopping
it.
But even that minimal, that very minimal amount of fraud prevention wasn't being done at all. It is now, though, luckily. Since our article came out, the state of Ohio announced that GPS verification will be mandatory again. They will start actually using the EVV data again. And they actually put a complete freeze for the next 6 months on new home care companies in the entire state of Ohio for Medicaid. And also one's been done nationally for Medicare as well. So there's, big steps being taken in the right direction. Thank goodness.
Yeah. So let's talk about that real quick. I mean, when this story hit, the first word out of the governor's office was, oh, no, this is not a big deal. There's nothing here. This is over the top. Then all of a sudden there was a slew of press releases on, well, we're doing this. And, actually, this has been in the works for some time. Talk us through the reaction since the story came out.
Yeah, so the first part of the story came out, and it was just a summary of, this is what we are going to publish this week. Brace yourselves. And then Governor DeWine's office responded to that part of the story, which just had, the top-line details. and said, well, we read the story and it doesn't look like there's any fraud actually alleged. We're very proud of our anti-fraud system. They actually bragged about this EVV system that they have since, like less than a week later, they overhauled the entire system. Like every part about it was changed a week later, and they bragged about that system to us and told us that there was nothing to our story. So it was, they basically speed ran the entire, overhauling the entire Medicaid system.
So Parker, I just recently applied to be a home health care aide for my wife. Come
on.
Are you telling me they're not going to look at my application?
You're done. You're out.
No, you submitted an app. You can. In fact, I wrote an op-ed for the Daily Wire. You could have just submitted the application under an entirely fake name. You could have lied about your nursing credentials to get more money for the home health. And these are all like fraud convictions that have been busted not only in Ohio, in every state around the country. There's no verification being done at all. So you could have submitted yourself as whoever you wanted to be.
Well, that's one of those things, Parker, that and I'm trying to remember which of the stories I saw it in from Luke, but you looked at some of the names of these folks that were doing this, and it was like Abdu. And were they just not submitting ID? Were they not, maybe these names were real. Some of them didn't seem like they were.
Yeah, we would show up to companies. Like one time there was a company billing several $1 million. We showed up to the place where they were supposedly registered. They just weren't there. And then we went to another office that was, seemingly unrelated. We found them there actually. And then, we knock on the door, no one's home. These companies, like one of the people that we investigated, he was a nurse who had his nursing license revoked like twice. And then the nursing board told him he's not allowed to work in either home care or in the finances of home care, but he was owning the company. But then he said he didn't own I own the company, but I don't provide home care and I don't work in the finances. So what do you do? Also, that guy later ended up threatening Luke's family. Like we asked him questions on the phone. He started reading off the names of Luke's family. Very disturbing. And then a unrelated cell phone, we think it was his secretary's cell phone, called a minute later and then did it again. So like very disturbing stuff. Yeah, there's no way to really even tell who's doing the care. There's no, like, all of the patient, the people providing the care. There's no way to check on that. There's no way to check on who owns the company, because you can just kind of lie about that and no one seems to be actually checking. It's a mess.
Is this a story? Because, you get this angle of, everybody's about fraud and stopping fraud. But then when you put, people group on there, Somali fraud, then, okay, now you lose half people because they're saying, you're just picking on folks. What is the process? Are we talking about just Somali fraud here, or are you all just looking at Medicaid in general? If so, if it's in general, what percentage of this fraud is specific to the Somali community?
In the areas we've looked at, like in Columbus, we looked at Columbus because we started with the state of Ohio, right? Because I found the thing in the suspicious trend in that one area of Columbus. I brought it to Luke. He said, okay, let's look at all of Ohio first, just to see like what the picture is we're dealing with. And 40% of the home care spending in the state of Ohio is going to like Franklin County, which has like 11% of the population of the state of Ohio. So immediately we're like, wow, this is suspicious. And then as the auditor specified, like there's like a 4 square mile area where it's actually like well over 15% of the state's spending on home health is being done in like this one little tiny 4 square mile area, which is the heavily Somalia dominated area of Columbus. But that being said, it is not all, people from Somalia. There are convictions in this program. This program is defrauded in every state by people of all nationalities and origins. People who are what you would call like heritage Americans or whatever. Also people who are like, the program is just a problem. It is too easy to defraud. And there needs to be some serious changes made to it. But no, yeah, it is, there is lots of Somali organizations, particularly in Columbus, doing it, but it is not all Somalis by any means.
Well, and let me ask though about that, because this isn't the first sort of Somali fraud story we have going on. Parker, did your investigation reveal how does this so systematically happen in a community like that? Is there like is it just word gets out amongst friends or neighbors that, hey, you can do this and get away with it. And the other thing about it too, Parker, that I find, this is probably more conjecture than it is, actual reporting, but it feels like they have a playbook. A lot of the Somalis, that when you go and talk to them, that it's like, just call them racist and they will stop investigating. Like it's frankly, one of my perspectives on this whole thing is like, that's a part of the reason why this fraud was allowed to go on so long, is you have individuals in government who look and see, well, this is a Somali sounding name, I don't want to go after them because that would be racist. I don't want to be accused of being racist. What's your perspective on how this actually goes, and how they weaponize that racist claim?
Yeah, I mean, I think that's 100% right. Like, there is a playbook there. Like, when there was one example, we were walking through the building, and there was home care after home care company, most of them empty. We were knocking on doors, no one answering. Then we finally found one where, like, they had glass on the door and it wasn't blocked out. So we could see there was a person inside. So we knock on the door, and we asked the lady at the desk, we just want to talk to somebody about, like, what goes into home care, what services does your company provide? How many clients do you have? Et cetera. And so she said something to somebody we couldn't see, kind of away from the door. And then behind us, the door of a trucking company opened, and this, a big dude came out and started, like, immediately getting very confrontational, getting in our faces, saying, "I'm going to tell everyone you're racist. I'm going to tell everybody," like, and saying, "Journalists, I don't care about you. You don't pay my bills. I'm going to tell everyone you're racist. Go away." Which we didn't even know we weren't there to talk to him. He said, "Oh, you're only interested in Somalis." We weren't here to talk to you. We were talking to her. But it does seem to be the playbook. Just yesterday, actually, Luke was testifying in front of the U.S. Senate with a woman in Minnesota who was, a veteran fraud investigator over there with their Department of Medicaid and Health. And she faced she testified about enormous amounts of retribution she faced for investigating the daycares over there. The Leering centers, as it were. And she specifically said, like, I was accused of racism for these investigations by, people within the government. Even though I don't know her personally, but I couldn't imagine that would be true based on what I saw from her testimony. She seemed like an incredibly nice and God-fearing woman. So it is absolutely a playbook, and I think that's part of how this, like, it's very blatant. All of the stuff that we've written about, it was very blatant, and it's been going on for years. The only explanation to me is that, there's pressure inside the government investigation departments to try and, kind of silence the uncomfortable narrative around this.
So I know we've been talking about the home health care side. What are you seeing in Ohio in terms of, like, the child care side, right? Because I know that was Minneapolis's main thing.
Oh, we didn't this investigation took us months. We've been working on this since, like, January. And we've only just we only focused on home care, and we only focused on home care being done by Medicaid. 30% of it is also done by Medicare. But while we were in Columbus, and this is one thing we noticed, owners of these home health companies, I think at least one of them, for example, a woman named Esther Achiampong, who was running I think $7 million per year, or it was maybe either per year or over the last couple of years. Her home health company that kind of emerged from nowhere, her previous job was running a daycare in Wisconsin, which the license to run the daycare got suspended because investigators showed up and said, "Hey, you've been getting a lot of money. Do you have any attendance records?" And she said no.
Wow.
And then just left the state. And then they actually got sued, a civil settlement against them for rent that they just never paid. Like $50,000 worth of it, I believe. She was not the only one. There were, I think, 5 or 6 different home care companies billing millions of dollars who had previously or were currently running daycares. When you were driving through this area, I mean, literally, the only thing in that area of Northeast Columbus that we were driving through, there were three main types of companies. There were ethnic food markets, kind of like the Small Business Administration incentivized these with a program several years ago. And many of them are often tied up in SNAP fraud, food stamp fraud. but there were the ethnic food markets, there were daycares, and there were home care companies. I mean, really, the entire economy of this area had been decimated. You could see, like, there used to be a Rite Aid there. Now it's nothing. There used to be an auto shop. Now it's a daycare. There used to be, an office building. Now it's all home care companies. So the daycares, there were, you could just drive down the street and there was, like, at one point there was like one block we went down, and I think we found 4 or 5 daycares just kind of in a row, one after another, all in the same block. Nothing really going on. No cars outside. No.
Oh, that's Parsons,
anything.
right? You drive down
like,
Parsons. You know, we live in Columbus. You drive, you drive down Parsons Avenue in South Columbus, and every other former office building or whatever it was or storefront is a daycare, right? And all of them, the windows are all covered with kind of worn pictures of butterflies or kids or whatever, but the windows are completely blocked out from being able to see inside and all that.
Yeah, and we didn't want to go after the day because there was clearly a problem in the home care companies. We didn't get into the daycares all that much because we don't want to scare people's kids. We don't want to show up with cameras at daycares and stuff. But I can't imagine that those daycares are being run honestly in Columbus based on what I saw in the home care industry.
Well, this was again one of my frustration, and Parker, I'm glad you get to interact with the Ohio Press Corps because we deal with them all the time. But Jeremy Pelzer from Cleveland.com, and Jeremy, and he's citing a story from Anna Staver, also from Cleveland.com, 2 individuals who we've had good relationships with in the past, but can drive me crazy with their covering of situations like this. Their ex post on this, Republicans are pointing to a series from a conservative news outlet to assert widespread Medicaid fraud in Ohio. But as Anna Staver explains, the evidence, while concerning, doesn't prove how much fraud there actually is. And the article itself says, exactly how much fraud the data shows remains unclear. The records track Medicaid payments flowing through providers, but they do not show whether services were actually provided. So, I mean, they got you, Parker. You guys just got to go home.
Oh man, I can't believe that I've been debunked. Oh no. It's asking for an impossible. It's an impossible standard of proof, and they know it's an impossible standard of proof. We showed every piece of evidence we possibly could. We documented things so incredibly thoroughly. It took us like 5 months to finish this project. They know very well that because home care, by virtue of being home care at home, the only way to prove whether or not the care is actually happening at the scale that it is claimed to be, which again, I mentioned these numbers earlier, that there is an enormous spike in home care being performed in this one little area of Columbus that is defies belief. So there is clear evidence that something anomalous is happening. We get into the backgrounds of the people owning these companies and the trends of all of them being in the same offices and the offices being empty and mail coming out from under the doors and doorknobs being missing and closed signs and everything. We couldn't have been more thorough in explaining, like, this is one gigantic red flag, but we can't prove it because we didn't follow them around, apparently. I guess that's what they want us to do. They want us to follow every single person we're writing about around for like a week to months on end, 24/7, to prove that they didn't provide. Like, they're asking me to prove a negative that would require basically stalking someone.
Right.
And that's again, this gets back into why this program is so very difficult in terms of fraud prevention, because like it is just impossible to really do
and just again, this is where I don't know how else to say this, but it's almost like the woke mindset of, guys, can we just step back for a second? You have companies run in, like, alleged healthcare companies run in buildings that aren't suitable, to run a cleaning company out of, right? These things are rundown buildings. They have no actual staff there. There's no computers in there to be tracking what's going on. No, and the names are either made up, or when you actually do look up the names, you do find people convicted of all types of crime. Every red flag you could ever want, and yet still it's not enough to say there is something here. And it's
I don't know. Yeah. I don't know what amount of proof we could offer.
Yeah. To what degree would it
displayed every piece of evidence we could, and it just still wasn't good enough.
So Parker, what is the plan to hold folks accountable? right? So, how are we going to recoup some of these dollars, or what kind of reforms to Medicaid are we looking at that would prevent this kind of stuff?
That's a great question, and one we've been asked by legislators in recent weeks. And the best solution is that the problem is the program. The program of home care was built for an America that is not kind of the same America we have today. We have a much lower trust level across our society. We can rely a lot less, I think, on the honesty of two people in a room together. So the program itself kind of has a problem built in, but that doesn't necessarily mean we need to get rid of it entirely. But drastic reforms are needed. One of the things, though, short of those drastic reforms, something that can be easily done. For example, I do a lot of research on government spending, and I mentioned that Unique Foundation report. I found that that suspicious nonprofit in that building because there's a website called usaspending.org where the federal government, kind of records all the spending that it does. So if a nonprofit receives a grant or if a for-profit company receives a contract, that information is recorded in USA Spending. For Medicare and Medicaid, now obviously Medicaid is partially run by the states, so it's a little harder to track, but I don't think it would be impossible. There needs to be a USA Spending for Medicare and Medicaid. So people like citizen journalists, people, like Nick Shirley and me and Luke Rosiak and Chris Rufo, who's doing a lot of great work over in California. If that the reason we were able to do this story is because DOJ for the first time came out and published this Medicaid, spending data, which had never been made public before. And once it was made public, all of a sudden there's this huge wave of, stories about Medicaid fraud across it's sweeping the nation. I mean, like really, it's dominating the news cycle in ways that government spending never has before. And all it took was 1 year of data being published. If that data, if there was a law passed to codify that data must be collected by the states, turned over to the feds, and published by the feds annually, we wouldn't necessarily need to hire additional investigators. We wouldn't necessarily need to make huge changes to the program because there will be, journalists and watchdog groups will be empowered to actually police this without, and it also wouldn't require the disclosure of HIPAA data, just seeing how much the providers are taking in. Maybe another database that shows how many Medicaid and Medicare procedures each doctor in the country orders. There's already a database that shows how much each doctor in the country takes from pharmaceutical companies. It seems very reasonable that we should also be able to see and collect the data for how many Medicaid and Medicare procedures doctors are authorizing. And we'd be able to see, if one doctor is basically a Medicaid mill, that data would stick out like a sore thumb, and that person could be investigated A, by the authorities, but also B, by citizen journalists if the authorities aren't apparently willing to, which seems to be the case in a lot of states.
Parker, for me, the lost question in this whole equation, and we're gonna have to wrap here because we're spending so much time. But I want to end here with you. We could talk all day about this, but the lost equation last question in all of this is: are people actually getting healthier? And are we actually saving money? Right. That's to me with the home health care pitch. Right. The whole idea of we're going to risk. Right. If we were honest about ourselves when the feds created this home health care company, this home health care program. The idea is listen, we know we're not going to be able to create as much accountability for how the money is going to be spent, but it's worth the risk. The cost benefit is in the favor of creating this program because long term it's going to create better, healthier outcomes for Medicaid patients, and it's going to save money, right? So has this program been a success in any measurable way in either of those two areas? And if not, we should just scrap it. But is there any evidence to show this thing has worked in either of those two areas?
Not really. I mean, the program is not a bad idea. Like I said, it is not a bad idea. It's a lot of ways it's kind of like school choice, which I'm a huge supporter of. But for Medicaid, home health spending, it's like you can take the dollars that the government's going to give you and take them where you want to instead of where they say you have to, which works great for education. The problem is, like I said, a lot of people are willing to, fudge the numbers to get into home care, not so much with nursing homes. So if the only way it would be saving money is if there weren't people who were, eager to, scam the system a little bit. So if you're providing home care for people, it is going to be cheaper than a nursing home. The problem is if you're providing that care and they didn't actually need it in the first place, then it's not really cheaper than a nursing home. It's actually quite a lot more expensive, 100% more expensive, in fact. So, I wouldn't be able to say for sure whether it has saved money or not. And if it has, I guess good for the program, but that still doesn't, I think, in my mind, justify the amount of fraud that has been allowed. That's, that's kind of a moral stain on what might have been a fiscally effective policy, and one that isn't going to play out well in the long run as fraud continues and increases unchecked.
Yeah. Well, Parker Thayer, we want to continue to follow this story at Center for Christian Virtue. Appreciate you guys exposing the fraud here. Is there? I gotta ask. Is there more to come? Is there any tease you can give of further details coming out here?
There could be. There's lots of things going on that I've heard whisperings about. I know at least we seem to have confirmed that at least one person that we wrote about has fled the country. And
Mike Andrews
might not be coming back.
Yeah, no.
He said it was PTO.
Yes, we're on Mike's trail. That's actually that's why he's missing today.
Exactly. The first guy to flee the country in a minivan. No,
they took him to Guantanamo Bay. And no, there will be more to come. And Ohio does seem interested in actually fixing the problem. Thank goodness. Unlike many other states where they seem to think that the problem is not a problem, that everything is fine. So lots more to come, I hope.
Thank you for tuning in to this episode of The Narrative, presented by CCV and produced by Wessler Media. If you found today's episode insightful, leave us a review or rating and subscribe anywhere you get your podcasts. We're your hosts, Mike Andrews, Aaron Baer, and David Mahan, and we'll see you next time on The Narrative.